My name is Abdon Borges. I'm the medical director for Forever Young. I've been a practicing physician for the past 27 years. I have always wanted to be a doctor. Ever since I was about 6 years old, I knew that I wanted to practice medicine. My father was a physician, and I used to go with him to make rounds on the weekends. In the mornings, we used to go to the hospital and then make house calls back in the day. And I always thought it was the best thing in the world, and the impact that you can have on a person's life by treating them well and ailing them of getting rid of their ailments and curing them of their diseases was probably the best thing anybody could ever do, in my opinion. So I progressed with that. I've always been very interested in the medical profession. I fulfilled my dream of becoming a physician, and then I went on into practice as a hospital-based physician in Miami. I did that for a couple of years, and I had the opportunity to come up to Broward County to practice medicine here with a traditional private practice. I've been doing that ever since. My practice philosophy is, which is one that was developed over time, is based on keeping people as healthy as possible with preventive medicine, also trying to encourage lifestyle modification over pharmacologic intervention. When I met Carlton and Dennis, I realized that that was their ideology as well. I actually met Dennis years ago. He was my personal trainer for a while. We kept in touch after that stopped, and he was always very friendly with me. And he gave me a call one time about 4 or 5 months after we stopped training, after we stopped the physical training or the personal training. And he asked me if I knew any medical directors or any physicians that would be interested in becoming a medical director for their business, which was Forever Young. So I thought about it, and I thought, well, let me look into it, let me see if I can know of anybody. And I started researching what they did. I spoke to Dennis many times, and he presented a situation to me which coincided with my practice philosophy almost identically, which was making sure that patients' lives are enhanced and patients' lives are, improved by modifying their lifestyle and by replacing things they might be deficient in. So I told them that I'd be interested in becoming the medical director if they've had me. Fast forward, a couple of weeks and a couple of interviews, and here I am as a medical director of Forever Young. I'm very happy to be part of the family. Forever Young's philosophy pretty much parallels my philosophy of practice, which is, again, lifestyle modification, living one's life as healthy as possible to try to avoid putting more chemicals into their system and to try to avoid doing things that might be detrimental to them down the line. The only thing that is required is the patient's motivation. We try to encourage them to eat in a healthy fashion, exercise on a daily basis, do things that are basic things for the management of the human body and for the maintenance of the human body. Now, granted, this doesn't come, as simple as, taking something or a supplement and having you feel good immediately. It comes with a lifestyle modification. We implement a lot of dietary modifications, eating right, eating healthy, enjoying your life at the same time. Also, we implement a lot of exercise and a lot of physical activity, which again, it'll enhance your overall well-being and makes you feel better. That practice philosophy has been very successful. Patients want to feel well. People in general want to feel well about themselves. They want to be able to do things and enjoy life as long as possible, as much as possible. And we can make that possible for you. Myself, I enjoy the outdoors a lot. I'm very active. I'm extremely busy. I'm up at 5 in the morning every single day. I work every single day. I enjoy what I do immensely. Some people say I work too much. I believe that I'm not working enough. I think that I've got so much more to give. Like I said, I'm a very active individual. I exercise on a daily basis. I'm involved in the martial arts. I've been training in martial arts ever since I was 7 years old. I also do a lot of outdoor sports. I spend a lot of time outside. I exercise outside. I do a lot of running. And I'm very physically active. And I plan on being as physically active as possible till whatever time I can, as long as I'm around on this earth. And that's not impossible. We encourage that. I try to use myself as an example. I'm not a superhuman individual. I'm just somebody who refuses to let age define me. And I think that that's very important. I have patients in my private practice that are in their 90s and they're playing tennis 3 to 4 times a week. I have patients that are traveling the world, doing things they want to do, and they do not let age define them, and that happens as a consequence of their lifestyle. It's as simple as that. We help you out with dietary modification, exercise plans, hormone replacement therapy if needed. There's many things that we can do. And again, I'm very happy to be part of the family. I plan on being around with them for as long as possible, and that's pretty much it.